Okay, everyone, we're going to get started now. So, welcome to the Medentors Society. We're here for a very, very special third edition to our series where we bring in a host of a doctor or a dentist to give you guys a bit of an insight and a talk into what a career looks like. Now, for today, we've got Dr. Casaus, who Madia very soon, who's our dental lead, is going to introduce her. But before we get started, just to get the formalities out of the way, we're going to talk a bit about what we do at Medentors and why this is a great opportunity for you guys to get involved and hopefully make the most out of these opportunities to have guest speakers coming in. Okay, guys? To make sure we can keep running these. So, a bit about Medentors, our community, what we do. So, as you know, we run a WhatsApp community that has supported over 2,500 students now in their medical dental admissions as well as their GCSEs and A-levels. And that way, we've also managed to outreach to different communities and schools, visiting up to 20 schools now, in which we've given talks. And here, what we've done is got many students in the communities, handed out guides and resources to help level the playing field essentially with the application cycle, which there's lots of information for. And if you guys are interested for more of what we do, we've got a whole YouTube playlist that goes through the admission cycle and the medical and dental interviews, which can be tricky for a lot of people. Another thing we do is run our academy branch, which helps you guys excel in your A levels and GCSEs, as well as students from year 7s to 9, where we provide support with academic help, tuition, and other services that can really help you excel academically and get those grades essentially, because that's really the final hurdle for getting into medicine dentistry. And our outreach, we are really happy to say we have partnered with up now 20 plus partners and organizations now, so it's a bit outdated. And 2,500 plus students reached, and our students that are part of our interview course do end up getting a 95% rate of medical and dental offers, which is really excellent and up there. And it's no joke. It's nothing that's a fluke. It's something that really happens when you guys put in the work. So that's really what the community is about and what we do at the society. Now, what I'm going to do is hand over to Madia Rashid, who is our dental lead, and going to be talking a bit about what we do at the Dental Society.
Okay, so hi everyone, my name is Madiha. I'm a year 13 student and I'm an aspiring dentist. So essentially, I'm the dental lead for the Medentors Society. You're probably thinking, like, what do we actually do? So here at the Society, we are a group of students that want to lead this for other students. So we gather doctors and dentists and we host webinars where they can talk about their career and their specialities. And it's not just about their job, but it's about things that go, beyond their job as well. We want you to gain an insight into the actual profession and get you motivated about the various aspects that dentists and doctors have in their lives. And so today, actually, we've got Dr. Casaus with us. So I did work experience with him, and he was absolutely amazing. And he's going to talk about, how he's a pediatric dentist and he's worked in quite a lot of places. So he can talk about his pathway and career today.
Oh, thanks
Yeah,
everyone.
lovely. We're going to hand over to
Oh,
Dr. Casaus now.
thanks guys. I'm just gonna share my screen if that's all right. Hopefully it works. Share that. Mohammed Madiha, is that all okay? Can you see it? All okay?
Yeah, I can see it.
Perfect. Evening everyone. I just want to say a big
Yep.
thank you to Medentors for the kind invitation. I've always wanted to discuss my career because my career is just very convoluted. And I think it's really important for people, even, for more importantly for people who want to do dentistry, but even for medicine, because I kind of find myself in a little bit of both worlds. And I was always planning to do a careers day in my school, but then COVID hit. So this gives me the opportunity to kind of discuss how I found my path, not just in dentistry, but later on down the line in my specialism. Let's have a look. Yeah. So I just there's so much information out there, and it must be so confusing to decide what you want to do. There's a limitless amount of information available to you. What do you do? And it's not just kind of managing what career you're going to do, but kind of the trials and tribulations of day-to-day life. And it was just even more difficult for me growing up And when I was really young, I used to like reading, and I always had kind of enjoyed the kind of scientific thing. But pretty much my role models were my mum and dad, and my dad was a doctor. And growing up, I always wanted to be a doctor. I wanted to follow in his footsteps. I wanted to wear the white coat. I wanted to help people. I wanted to use clever scientific stuff to make things work. And so early doors, we would have careers days. And in the 90s and kind of noughties, the information was just appalling. We used to have these old computers. So we used to have these Acorn computers, Acorn PCs. We'd have these like really awful programs that you would click a few boxes and would give you information in regards to which career you wanted to do. To the point where I think when I was really young, I was kind of 10 or 11, and I was set to be a doctor. That's kind of what I had in my head. I click a few boxes, and it suggested because I liked playing football outside that I should be a gardener. Now, obviously, kind of things have moved on, but the beauty about things kind of back then was that I went to an amazing school. I was very lucky. I went to a state school. Um, but in year seven, when we joined, we had a new consultant who was trying to push boundaries. He was pushing us to be the best, and the support was incredible. I mean, we had amazing teachers, and I went um, to my high school in Cardinal Wiseman, which was in West London, in Greenford. And the support that I had from the teachers and from my kind of fellow students was incredible. I stayed on, so I stayed on to do sixth form there. And that was when it was a lot more kind of, you had to be a lot more proactive to get your stuff done. And we had some amazing teachers. My biology teacher, Mrs. Dodds, who had written a biology textbook, she was pretty much the one that supported me with not just kind of career choices, career decisions, but kind of academically to get the scores. And we had loads of fun at school. I mean, I remember a school trip, and these pictures are fuzzy for a reason because they're quite old. But I remember a school trip that we did to Barcelona, and we had such an amazing time. It was the first time that I'd been kind of outside the country without my family. It was just a very, very strange feeling, and it was going to be a bit daunting going to university the following year because I'd never lived out away from my family. What was I going to do? I remember my mom talking to me about how do I make eggs because I'd never cooked before. It was just a really weird experience. But my main conundrum was this one. So I remember having a conversation with my dad, and I was like doing my UCAS application, and I had mixed. So I remember writing my personal statement and mixing both medicine and dentistry. So it was really fuzzy whether I wanted to do medicine or dentistry. Because the idea of dentistry came into my head by a few friends who said that actually dentistry would be easier than medicine. Um, and I had a chat with my dad, and my dad's very blunt. And he said, don't do medicine, avoid medicine at all costs. And I'd seen growing up how he had worked extremely hard to kind of put food on the table, support us. But there were times where he did loads of locum work, he did loads of on-call work. And compared to kind of a lot of families that saw their parents or their family all the time, my dad wasn't around as much as he'd have liked to have been. So what did I do? I decided to do dentistry. I think my dad put me off massively, but I didn't have any insight in regards to the dentistry world, what it would mean to me career-wise, and what it would involve. Once I've decided that, I made a decision about where to go. And so I had two offers, one from King's London or King's College London, and one from Birmingham. And I'd never been north of Watford. I'd never left London. Why would you leave London when you're kind of growing up in the suburbs? But I didn't want to stay in London. I wanted to kind of explore what it was like living out, push myself a little bit, um, kind of support growing up as well. I wanted to be a proper adult and I didn't want to live at home. Um, and also that King's living in London, I'd have to live at home. And I don't think that I wanted more freedom as a 17, 18-year-old. So I picked Birmingham, and the interviews, as you guys are well aware, are completely different to how it was before. It was a case before of having to drive up to Birmingham, which took us 4.5 hours because we didn't have Google Maps. And we had to use an A to Z. We got lost in all the roundabouts around central Birmingham. And then it was a 20-minute interview, discussion about why would I do dentistry? What was my work experience like? What sports did I like and how I could show manual dexterity. And I remember it wasn't really that well planned because, I mean, my manual dexterity or how I exemplified manual dexterity was repairing old socks because I used to get holes in my socks all the time, which just sounds ridiculous when you talk about it out loud. But it made the interviewers crack up and laugh. And I think that broke the ice so much that they were very happy to offer me Birmingham. Um, and I did enjoy my undergraduate career in Birmingham. Um, Birmingham was like a vibrant city, was great fun as a student. And the hospital, so this is the old dental hospital. So I started here in 2004 and left and graduated in 2009. And the old Birmingham Dental Hospital, which, if you guys are aware of Birmingham, it's next to the old Children's Hospital, or used to be next to the old Children's Hospital, and was a great place to get lots and lots of experience. Unfortunately, it was shut down in 2016, but part of the demolition crew were able to take old photos of the old dental hospital, and it was very, very old school. So it was like very 1960s. The It had asbestos in it. Everything was really run down, broken down. The old dental chairs looked more like kind of being at the barbers. We had these really weird chairs and equipment, but the staff were amazing. The teachers were incredible, and they were so supportive. The one thing it did have, however, were these weird paternoster lifts. Now, the paternoster lifts were kind of a genius product where you'd be able to jump in and jump out of these lifts without having to kind of open any doors or shut any doors. So the movement of people was amazing. And this was like something very novel that none of the other dental hospitals had. But unfortunately, they kept breaking down because people kept jumping in and destabilizing the whole thing. And it was quite sad that at the end of my undergraduate training, that they plastered and paved it all. It was kind of the beginning of the end for my career, or for my kind of undergraduate training in Birmingham. Has kind of symbolized it a little bit. But we had an amazing time. We had a great year. Everyone was really supportive. Everyone cared about each other. I think at the beginning there was always that competitive drive, which you get a little bit in sixth form, and it was tough for me at the beginning to go from high school being top of the class and then being kind of thrown in at the deep end with all these academically brilliant people and having to kind of reach a minimum standard. And I was never going to be top of the class at dental school, and I didn't really want to be. But at the same time, that kind of subsided massively to a point where it was a bit of a close-knit family where people would help each other out, and go out of the way to support you when things were low. And then we had, lots of parties, lots of fancy dress, loads of kind of massive socials that kind of brought you closer together. And I can say honestly that my closest friends today are from university, because kind of living with each other, going through the challenges and the difficulties that we had during undergraduate training, because it's obviously a lot of work, a lot of exams, and a lot of pressure because you are young professionals, then I think made us kind of become closer together and kind of friends for life. But luckily, I graduated and I went into practice. So in dentistry, if once you qualify and you want to work in the NHS, you have to do a 1 year, which is called a foundation year. And this foundation year gives you a kind of puts you in a supportive environment and a practice which is geared up to provide that time for more than kind of for more support, more training. Just because you do 5 years in dental school doesn't mean that you can go out there and do everything. That you need a lot more support and these kind of which it used to be called vocational training, now it's foundation training. Can provide that. And I did a year in Wigan where I saw, a large number of very vulnerable patients from kind of really severe lower socioeconomic backgrounds, compared to in Birmingham where we used to see a lot more elderly patients as undergraduates. So it was a real eye opener, but it was a really lovely practice, lovely clinic. But it's only 1 year. And after that 1 year, what do you do? Where do you go from there? And there are so many different choices. And information-wise, it was very, very limited. And so I was again at another crossroads. What do I do? I was offered a job up in Wigan where I could work in practice. So it would be doing 5 days of NHS dentistry and practice in a small little site. Or do I go down the hospital route? And with the hospital route, that means kind of doing more training. But there were lots of things to think about. And going through my head, I had all these. I had most of my friends went into practice. So they didn't have a salary sacrifice. Hospital salaries were a lot lower for training. And so you'd go into practice, you'd work really hard, and you could make easily a lot more money than someone who would have to take junior jobs and not get paid as much. There's also interviews. So these junior jobs were kind of only 1 year. And so every single time you picked up a junior job, you'd have to be interviewed. And then historically as well, you would have to have those interviews at those local centres. So you would be travelling to have those interviews kind of, Birmingham, Manchester, go to Glasgow, go down to London. And also, you didn't know where you'd be year on year if you had 3 junior jobs, but they were all from different geographical areas. That's where you would go. There was also the work-life balance. When you're in practice, less so now, more so then. And you did need to build up your CV. You could just see the same patients, build up your kind of CPD, your continued professional development, kind of in regards to certain areas, but there was no specific training. You didn't really need to enhance your skills if you didn't want to. Whereas in hospital, you had to work hard in building up your CV. So doing lots of publications, doing some research, doing lots of kind of service evaluations, audits, kind of discussing case reports. And then you had exams. If in the future you wanted to kind of go down the hospital route, you would be examined. And some people, after 5 years of dental school, had enough of exams, and they said, when will this stop? I don't want to be examined anymore. Why? Whereas if you wanted to go down the hospital route, you would have to be examined. And so I had done my junior jobs in Birmingham, and then I applied for my specialist training in pediatric dentistry. And pediatric dentistry is a bit odd, where if you wanted to be a specialist, you could do 3 years of training. And then additionally, if you wanted to be a consultant, you would do an additional 2 years. Whereas now it's changed, now it's 4 years. So I applied for specialist training, and I got in, and I was very lucky to stay in Birmingham because I enjoyed the city. I didn't want to keep moving geographically. I had my friends. I wasn't too far from London to see my family. And it was a really nice unit. And I had the best time as a registrar. So you become a registrar and you do your first 3 years. And I, it was kind of going back to the old dental hospital for my training. So it was much easier for me. It was much more fun. And I met kind of my close friends there. And we were kind of pushed. Yes, it was difficult because we'd have long work hours. We'd have to go above and beyond to develop our skills. But there were also massive perks in our registrar training. And the main one that I really enjoyed was the conferences that you would go to. And so this is where we would kind of publish or kind of present about our work or our research. And so I've been really lucky to present work in Cancun, in Mexico, in Barcelona. In the bottom left corner is Glasgow, but I don't think I've ever seen it that sunny. It must be AI. But the middle one, the fondest one that I did was a trauma talk in Brisbane in Australia. And I was able to present kind of my novel work there. And it was just great seeing lots of different people, networking with other people from all over the world, talking about things that you enjoy. And I think that hospital training has that advantage where you are able to kind of be supported to go publish work and discuss your work, be funded to do so. And that's where I met my most close friends or work colleagues at conferences, networking. And it's actually really, really rewarding that you're doing really high level stuff and be listened to by professors and consultants from all around the world. So I kind of enjoyed that. That was the most that I really enjoyed. And when I used to tell my friends who used to work in practice, and they would have higher salaries, but at the same time, the one thing that really annoyed them was the fact that every few months I'd be able to go to a conference to talk about my work, either Europe, South America, Australia. As we finished our training, we were moved to the new dental hospital. And so the new Birmingham Dental Hospital was kind of built because the old dental hospital just had enough, bless them. But we had kind of jazzy equipment, larger areas, more patient-centered kind of areas to support our patient care. And it was opened by Queen Elizabeth II, and she came over in 2000, well, end of 2015, but it was officially opened in 2016 to commemorate the hospital. And I stayed there a few years. So I finished my training, my specialist training. I did my consultant training, more interviews, more exams, and I was able to get a consultant post in Birmingham. But what happens is life happens. And as a result, I met my wife, and she had got a job up north in Newcastle. And so for me, it was the end of an era. I'd spent approximately 18 years in Birmingham, including my undergraduate training. And so it was really sad to say goodbye, but at the same time that it was really good for me to try something new and have a very, very new challenge. Um, and so I moved up north, but at the same time, as an NHS consultant, I was branching out. I was looking at other opportunities, other financial opportunities, other challenges to carry out. And what you may not be aware is that pediatric dentistry or children's dentistry is very, very much NHS focused um, under the dental contract that dentists have. Children receive treatment for free. So why would families explore alternative options such as private dentistry? But at the end of or as I was leaving Birmingham, one of my friends, he was wanting to set up a specialist practice in Barnt Green in Worcester Way, and he wanted me to take lead on the pediatric stuff. And so I'd never done private dentistry before. I'd never thought about it because we were very much NHS focused. But for me, it was an opportunity to do something different and also another potential financial pathway. So we started that practice and then COVID hit. And as a result of waiting lists, increased waiting times for patients, the demand was produced for pediatric dentistry. And so at the minute, I do lots of different things from then, and I've moved on from then where thought this picture kind of defines me in a week geographically. So I do, as my NHS consultant post up north, I work in Leeds at the Dental Institute, and that's pretty much my NHS side of things. I still go down once a month to Bromsgrove or to Worcester, sorry, to Barnt Green to do my private dentistry or private children's dentistry down there. But I also do some in my hometown in Newcastle. Um, it's a lot of traveling, it's a lot of moving around, but it's worth it if the job satisfaction is there. And all the different places that I work, there's a lot of job satisfaction. And predominantly the first job satisfaction is treating the patients. And there's a huge variety in the patient base that I see. So in Leeds, the Dental Institute that I work in, I see a lot of children with complex medical needs, children with oncology, liver problems, bleeding disorder issues, wide range of medical stuff that need dental support. And so there's also a focus on the multidisciplinary team stuff. So children that need complex dental management. And I'm just going to say that the next few slides, there's a little bit of surgery shown. So if you guys don't feel comfortable, please look away for the next few slides. It's just to exemplify or to show kind of the complex work that we are doing in the hospital setting. And so this is a boy who was 13, 14 years old, and he knocked his front teeth. He broke his front teeth. He had root canal treatment done on those front teeth, but sometimes with root canal treatment, it can make your teeth a little bit brittle. And so as a result, his top right front tooth broke. And he wanted something where he didn't want to put a denture in, where he'd have to put it in and out all the time. He wanted something stuck on in that area. So working in a dental hospital with lots of different specialities working together, we were able to do something really cool and novel where we could actually pull the tooth out of its place because it didn't have enough tooth surface to stick something on. So we brought it down from the gum, let it heal, and then fixed it with a white filling. And those things can be done in practice, but they're much easier to do in a hospital setting. And you've got the number of people and the experience there, consultants from lots of different specialities, to make a big, big difference to something that was really complex. And in kind of, in on average, that patient would have had their front two teeth taken out and then have to deal with a denture for years and years until he was a lot older for possible implants. The thing I do a lot of as well in the hospital, less so in practice, is teaching and training. As a consultant, my big role is to develop new trainees, new consultants, new specialists, and I want to get the best out of them and also make their training enjoyable because my training was enjoyable. And if you enjoy something, you're going to be really good at it. We also have in Leeds a big, big postgraduate program. So these are dentists that have trained all over the world and want to do their specialist training in the UK. And so we've got a very, very large cohort in Leeds where we develop their skills. And it's great to see lots of different cultures, lots of extremely hardworking people that do excellent training in the UK and then go back home and are incredibly successful. And that's something that I really, really enjoy and I'm very, very passionate about developing the next generation of specialists and consultants. Now, the teaching and training is less so in practice, but also it's extremely rewarding. As I've mentioned before, I work at Restore Dental Specialists in Barnt Green in Worcester, and I also down the road from me work in Newcastle and Kelvin Lodge Dental Hospital, Kelvin Lodge Bupa Dental Care. Now, these patients that I see are predominantly more complex dentally, but generally medically fit and well. And day to day, I'll see patients just like this. So this was a 4-year-old girl who had decay on her baby teeth and had infections. And we were able to take that infected baby tooth out for her. And so I see a lot of anxious children, children that find having dentistry really, really difficult. And so predominantly in practice, my bread and butter is managing those anxious patients to have dental work. So she was really, really good. And she had local anesthetic and she had her baby tooth taken out and that tooth healed. But I also see a lot of cosmetic stuff. So this was a boy who's got these brown patches on his front two teeth, and we were able to polish those off so that he could have a big, big smile again. We also do things like bleaching in children to lighten teeth up. And this boy, he had had an injury on his front tooth and had a root canal treatment. But after his root canal treatment, his tooth discolored and went grey. He wasn't smiling. On all his school photos, he'd keep his mouth shut. It was affecting his quality of life. And we were able to bleach that tooth. And we've done lots of aesthetic work as well on other children who, no fault of their own, are born with these developmental dental anomalies. It's not because they're not brushing well enough. If anything, these kids tend to brush better because they feel that by brushing more that the teeth will be whiter. And we're able in practice to deliver such aesthetic care. And you can have the same treatment done in the hospital setting, which usually waiting times and seeing lots of different people. Now, it's all well and good. I've told you all the positives, but there are some definite obstacles in my career choice. And my main obstacle really day to day is the geography, to try to find the right job and to try to find the right people. You have to move around sometimes. And that's really, really difficult for people who've got settled families who aren't flexible enough to move. There's also the issue about at risk of legal action. Medico-legally, things have been increasing in the profession. If you do things wrong, there's always the risk that of kind of legal action against you, and having to manage that is really, really stressful. And then in the private world, I have to talk about money. So when it comes to seeing patients in the NHS hospitals, I don't have to talk about financial issues or the family paying, but it can be really, really stressful and difficult when you're having to when you're having to describe charging families for treatment and making sure that things don't go wrong. Because when things go wrong and you're talking about money, it can be really, really stressful. So these obstacles make my life really difficult. But at the same time, those are overcome by the super, super positives. And it's just so amazing to make a difference to children's families. And children and parents are so, so, so grateful when sometimes you can do the smallest things to make a big, big difference. And it's amazing that you get patient and family feedback, but also from your colleagues. I've been lucky enough to be nominated for the Private Dentistry Awards, and it's just, I think it's an awesome thing to be highlighted as someone who's going above and beyond to help their patients and providing very niche care. Because at the end of the day, in children's dentistry, there's not many of us at all in the private world. And so just to kind of show that actually there are specialists that are able to go above and beyond and provide excellent care is a true thing. The one thing, however, that I couldn't do without my dental team supporting me. And I think the one thing that I was taught before I kind of, or when I was starting dental school, is always, always, always be super, super nice to your dental nurse, because your dental nurse will go above and beyond. If you're having a really rough day, they'll be able to pick up on it. They'll bring you a cup of tea. They'll tell you, look, go off, take a break. They'll be there to support you. And also my colleagues. So my colleagues in practice and in the hospital are amazing. When I've had any issues, when I've had complaints, because every single dentist will receive a complaint at some point in their career. It's guaranteed. And it's how you cope with it. And I wouldn't be able to cope without my colleagues there supporting me and kind of having my back. And importantly, it's what you've got at home as well. And I'm very lucky. My wife is, she supports me and goes above and beyond to ensure that when I've had a rough day, that she's there to listen to me, to give me advice. I mean, I've got these two naughty cats who will somehow know that if I'm having a rough time, will sit on my lap and tell me it's all right. And it just goes to show how important it is to have a really, really supportive framework, especially when you join these really, really rewarding, extremely tough professions that can make a week that's amazing and wonderful be really, really difficult. So thank you for listening for my talk. It's just a take-home message would be that you have plenty of information available to you now to make a reasonable decision about whether dentistry or medicine is for you. I wasn't lucky enough to have that information. I wasn't lucky enough to have that insight. I kind of went into it a little bit blind with my dad as my role model who put a spanner in the works. But please kind of go to your work experience, ask lots of questions, talk to lots of different people, read lots, because I saw in my first year in dental school, about 15 or 20 people out of 80, I think we started, who dropped out. And that's because they didn't have all the information and they started that career and they said it wasn't for them. And so, from my perspective, please, please, please um, listen to as many dentists and doctors, talk about their experiences, and make a reasonable judgment. And from my perspective, if you want to kind of continue to follow my journey, um, I'm on social media, I'm on Instagram, more than welcome to follow me. I kind of highlight all the private pediatric dental cases that I show. A lot of my dental anxiety patients and what they're able to achieve is incredible. So please continue to follow my journey. And just want to say thanks. I'm kind of hoping to try to answer as many questions as I can. Thank you so much, guys. And I'll stop sharing.
Thank you for that, Dr. Casaus, for an excellent presentation going through not only your personal journey, but your professional one too, where you've really broken down for us what it means to be a dentist and what it takes. Now, I'm sure everyone here is buzzing with questions. So what we will do now is on the chat, if you guys have any questions for Dr. Casaus, it can be personally related, it can be professionally, anything to do with that, feel free to ask. Treat this like your own work experience, essentially.
Cool. So I can answer a couple of these questions. So, how long have you been a dentist for? I always make the joke too long. But I I started training in 2004 and I qualified in 2009 and then did lots of little jobs. And then I did a 5-year training program. So to date, I've been a dentist for roughly 16, 17 years. Um, so it flies by, it absolutely flies by. Um, so I was going to ask what made children's dentistry. So yeah, I in the fourth year, so you start kind of in Birmingham at that time, you start pediatric dentistry in the fourth year. And so it was a case of I was just very good with children. I was very good at building rapport, um, kind of just chatting rubbish about stuff, getting them at ease and getting them to like you. And I think that stems from the fact that I come from a very multicultural background. I come from a large family where I had to I was the one who was kind of babysitting lots of kids, and I had the idea that I knew that how they could click. And then slowly, as I went into kind of my foundation training and practice, um, I was able to get on with kids really, really well. And then I thought to myself, well, actually, I'm very good at working with children. Why don't I try to do that in dentistry more formally and specialize? Um, and so that's why I went into pediatric dentistry. Regret anything about my career? Uh, Difficult to say because I had such a good time. So I enjoyed kind of all the jobs that I did. Um, Biggest regret, I don't think I really regret anything. All I do regret is having more of an insight because, and I think someone talked about how stressful an undergrad is that I found undergrad early doors really difficult. You go to you go to sixth form where back in the day it was a chalkboard. And so it would basically be you. I remember Mrs. Dodds, my biology teacher, and she would write everything on the board, and I would just copy. And then it was a case of rote learning and then just apply it in the exams. Whereas when I went to university and you start, you're like, there is no writing down everything copy. It was all proactive learning. going out, doing your own research, having to read lots of different textbooks, um, managing that with the pressures of being social, um, and then the manual dexterity side of things, where I didn't do much DIY as a kid. And then you're having to do these really kind of fine motor skills with your drilling and your kind of clinical skills. And that took a long time for me to pick up, to the point where I was kind of slightly behind in the group in third and fourth year. And then fourth year, something clicked where I was able to get it. It took a while, but I did get it. And that was just with hard work and practice. Um, so you can, if you do struggle manual dexterity wise, I mean, you need to first of all think, is dentistry the right thing for you? Because it's having excellent manual dexterity skills. You can train and practice it. Um, what advice would you give to year 12 students hoping to study dentistry? Talk to lots of people. Talk to lots of people in practice. You'll have your work experience. 90% or more of people doing dentistry will work in practice. Sometimes you may want to work in the hospital setting and it doesn't work out. So it's being comfortable that you can work in practice and those demands. Let's have a look. I think Zara asked, thank you so much. When you said finding work geographically is difficult, is that due to your work as a pediatrician specifically or because you worked in the hospital? Geographically, it's because there's only a small number of NHS consultant positions, and it's extremely competitive. And so I've applied for work in the Newcastle Dental Institute or Dental Hospital, and I haven't been lucky enough to get that post. And so geographically, the nearest post is either Edinburgh or Leeds, and I was lucky enough to get Leeds. And so to the point where, as a family, we have to decide where we're going to live, where we're going to settle. And so at some point, there has to be a sacrifice. And for me, the sacrifice is traveling to Leeds and Newcastle back. And then there are such good job opportunities available, and the established list that I have in Worcester and all my friends are there. I'm happy to do so to travel down there, but traveling on the train regularly all the time can be quite significant. But then that's when you have excellent teams who support you, who are aware of that and can make your kind of job plans flexible. And I've got a really, really supportive family. Do you regret choosing dentistry now? Would you rather have done medicine? So, good question. So when I qualified from dentistry and I did my vocational training, I did I did 2 years one in oral surgery and one in children's dentistry in the hospital. But it had a max fax attachment, so maxillofacial surgery, where you would do on call for maxillofacial surgery. And so I did 2 years of on call at the children's hospital, and it was tough. You'd do your 9 to 5 job, so 9 a.m. to 5 p.m. And then at 5 p.m. you'd pick a bleep, and you would get called out for any particular injuries for children, any kind of maxillofacial injuries or dental injuries in the hospital. So there were times where I would be awake from 9 till 5, and then on call, I wouldn't have slept. And now there are safeguards that kind of ensure that such kind of trainees have got enough rest, but there was less so kind of those safeguards back then. And that was really hard and that was really demanding. I think for medicine, that on-call element is really tough because obviously there are evenings, early mornings, they're antisocial, and there's a lot of running around. And also that because you've got a kind of a skeleton team, because it's obviously out of hours, then sometimes support is really, really difficult. But you grow up quick, and a lot of people either thrive or don't. And I enjoyed that ability to build up your leadership skills because you're on your own. You've got to make a decision. You've got to do it for the patient. And so I loved it and I hated it, but I wouldn't want to do that for the rest of my life. And so I don't regret choosing dentistry over medicine at all. And I think that for me specifically, I think my dad was right, but I know that medicine is incredibly rewarding, but you have to be passionate about it and you have to understand what it's like. Uh, what dental books would you recommend to get an insight into dentistry? I wouldn't recommend any books. I think it's a case of talking to people about it. And I think what Medentors are doing is fantastic, getting people to be really open about the positives, but also the difficulties in choosing such a really, really demanding career. And so I would listen out to people. I would ask lots of questions. Your work experience is vital. And don't be like me. I mean, I remember doing work experience for a day at my dentist, asking him a few questions, and then that was it. I had no clue what it meant um, to be in practice day in, day out with the issues that you have to manage, manage staff problems, equipment issues, material issues, patient complaints. There's lots and lots and lots that are dealt with, which if you do a day in work experience, then it's tough. Uh, prices of services. In private practice, there is no set low or high limit about what you charge. At the same time, it has to be reasonable for the patient and it has to be reasonable for yourselves in regards to what materials cost, equipment cost, um, staff cost, also the practice. So you can charge whatever you want technically, but generally speaking, if it's going to be super, super high, then if someone takes it, if a patient is happy to pay that much, then you've got to really, really deliver. And it depends on kind of on average what private dentists around your area are charging. So I can't really give you a specific answer on that. It's based on lots of different variables. Work-life balance. I think that you can choose how much you want to work. I know friends that work 6 days a week. I sometimes work 6 days a week, but then work 3 days a week. So I have a nice mix and I enjoy it and I enjoy my job. So the work-life balance is what you choose it to be. No one is going to force you to work 5 days a week. No one's going to force you to do 6 days a week. No one is going to choose to work no one's going to force you to choose 2 days a week. So there's flexibility in regards to how much you want to work, but obviously there are financial implications as a result. The main thing that the majority of people are veering away from is veering away from a 5-day week, working 4 days, but working hard for 4 days, and then enjoying 3 days where they can switch off. Let's have a look if there's any more questions. I might have missed some, guys. I'm really sorry. What's your favorite procedure? Yes. So you might be able to see on social media, I see a lot of anxious children, and I like to use these special video glasses to distract children so they can watch anything from Netflix, Disney Plus, YouTube. They can put it on. And while they're watching TV, I can do dentistry and it kind of distracts them and keeps them engaged. And we had this 8-year-old girl, and this was in the hospital service, who was super nervous. And she had bumped her front tooth and got infected and needed root canal treatment. And lots of people tried. I tried to kind of treat her tooth, but she was so anxious. And I thought trying the video glasses, and it was a time when Frozen was out, and I put Frozen on, and she stood still for the whole thing. She didn't move. She was happy to accept the local anesthetic, the drilling, the everything. And it was just an eye-opening moment. And so I still, with my best friend who I did training with in Birmingham, we still name this one particular patient as the kind of most memorable moment where she turned from super uncooperative to you can carry on with your root canal and I don't care. That was incredible. So I think I'll have one more question. Financially, is it better to be a consultant of the NHS or as a private dentist? Um, that's a difficult question. I think it depends on how much you're working. I enjoy my NHS side of things because I do lots of teaching and training. And yes, I think that if you were to be a full-time private dentist, you would probably make more money. But at the same time, for me, money isn't everything. I want to go home and have enjoyed my job and have made it really rewarding. I trained to do complex stuff. And so, from my perspective, I like to do the complex stuff, but I like to give back to the community and to support new trainees and specialists. And I couldn't get that done in practice. But a mix of both is really, really rewarding. So sometimes don't focus on the money, focus on what you enjoy. And if you focus on what you enjoy, you'll make money. I think that's the end of the questions, guys, because I think it's nearing 7 o'clock. So I'll leave you with Mohammed. Thank you so much, everyone. Hopefully, I've answered as many of the questions as possible.
Yeah, thank you for that, Doc. That was an excellent run through of your journey through dentistry. And the question and answer then really summed down many of the key misconceptions that people may have come across. So, essentially, guys, what we're going to do afterwards is I really want you guys to take this talk and take the most out of it in the sense that I want you to look at it and see, do the steps in Dr. Casaus's journey link to what I see in myself? Because if it doesn't, it's very important that we make sure we're picking the right career pathway for ourselves. So if you look at it and think this may not be best for me, then perhaps go back, reflect, try to speak to dentists, watch YouTube videos, and keep in touch with our society to see other speakers and see if it truly is for you. Because what Dr. Casaus talked about the statistics of 15 people in his class dropped out, that's very true for even me. In my own medical school cohort, a lot of people do drop out, and we wouldn't want that to be for you. But we understand that for you to even be here today, you're already very passionate about the career, and that makes you a heads-on person that's really ready to get stuck into the application cycle. Many of you guys are in year 12, and we are very excited for the plethora of talks we've got planned out with you in terms of how to reflect on work experience, doing your super curriculars, and getting prepared for that nasty UCAT exam, which I'm sure you guys will smash by the time we've drilled everything into you guys. Okay, so essentially, I just want to once again thank Dr. Casaus and Madia for helping me out with organizing this sort of event, and we're looking to do multiple, many more in the future. If you guys do have any questions, you can leave in our community, and I would definitely urge you guys to follow Dr. Casaus's Instagram page. That would be lovely if you guys could do that, because it'll give you more of an insight and follow his journey along with how he's getting on. And yeah, guys, any more questions, we can ask it in the WhatsApp community. And that's it for today.